sponsored by the Carpal RX. After you've had carpal tunnel surgery, whether by endoscopic surgery or open release surgery, there are certain things you can expect once you leave the operating room. The goal is to get your hand function back to normal, and to do this you must do two things. The first is to limit strenuous hand activity, and the other is to do hand therapy exercises. Limiting strenuous hand activity means just that. You cannot be expected to go back to do the things that you were doing before that hurt your hand, like overusing the computer keyboard, driving your car, or specifically gripping your steering wheel for prolonged periods of time, or going back to your occupation if it required using your hands a lot. In fact, about a quarter of patients who have carpal tunnel surgery do not return to their former profession. And if you've had surgical complications like infection or prolonged healing time, this may impact heavily on your occupation or your ability to go back to work, especially if your job is what caused your hand problem in the first place. The other thing you can expect after carpal tunnel surgery is to perform a regimen of hand therapy exercises. Hand therapy is designed to bring your finger, hand, and wrist function back to normal, or as close to normal as possible. This therapy includes finger, hand, and wrist exercises to increase your range of motion and the strength in your hand. Just how long your post-surgical recovery time will be depends on many factors. One of them is whether you've had endoscopic release surgery or open release surgery. Also, some patients naturally heal faster than others. Finally, a great proportion of patients require occupational hand therapy. You should discuss a slow recovery time and an inability to go back to work with your doctor, because these are some of the reasons why most people are dissatisfied with their surgery, whereas the vast majority of patients are satisfied with their non-surgical therapy. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Remember, those non-surgical options that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage, which is almost 100% effective in relieving symptoms. But it must be applied professionally and every day for at least 2 to 4 weeks. Anything less or improperly applied is useless. And to get professional and effective deep tissue massage therapy for carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms, and it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.